You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. And we're with New Hampshire's and Vermont's go-to implant dentist, Dr. Peter Bowman. Dr. Bowman, welcome to the program.
Thank you for having me, Randy.
So you do serve those two states,
Yes.
It seems like.
Oh, yes.
Is that right?
We've got people from both ends. There's really no line between the two. People coming from hour, 2 hours away sometimes.
Okay, good. Now, I know you brought a stack of photos, so we'll get to as many of those as we can. Mm-hmm. Now, for people that don't know your practice, like who's the typical dental implant patient?
Well, we don't have a typical patient at our practice, Randy, but most of what I do at Bowman Dental is I help people who have bad teeth, bad gums, or even no teeth, and I give them a set of brand new upper or lower dentures, anchored implants that don't come out. And we do that in a day.
Now, we talked at the top of the show, no more dentures. When we think of Vermont or New Hampshire, it seems like a healthy group of people. Are there really that many people either wearing a denture or headed to a denture?
I think you'd be surprised. There's actually a lot of people wearing dentures in the area. In America alone, there's 30 million people with dentures, something like 60 million people missing 8 or 9 teeth or more. So there's a huge need for implants, and whether you don't want a denture or you just want to replace a couple of teeth. So I think you could probably fill Fenway Park, Gillette Stadium, and the TD Garden just with people with dentures. They don't need them anymore.
So it's that big of a thing.
They shouldn't need them anymore.
Well, then
so
if it's so good, why aren't they doing it? Why aren't they all coming in to get new teeth supported by implants?
When you wear a denture, you don't go to the dentist anymore. So you don't always know your options unless you're coming in because you need that reline because your face got smaller, your denture feels bigger, and it won't stay in anymore. And that's when they learn that these things called implants can give them teeth that don't have to come out. And so the other reason they don't come in is they think they're too old for this. But the reality is you're not too old. I've done implants for a 98-year-old before.
So 70-year-old is not old?
70-year-old are just spring chicken. I used to think 30 was old when I was 13, back when I thought I wanted to, when I first wanted to become a dentist. But at 70, you're in your childhood phase of your retirement. So you have much more to enjoy, places to go, things to do. And those who have teeth that don't come out are much more capable of doing these types of things. People with a full set of teeth can't really appreciate the limitations that people have, in their function of what they can and can't eat, or even just socially. When you're missing enough teeth, it starts to hold you back. That's the case with anything that you don't like about yourself.
Okay.
And so over time, over years and decades, you start to hold yourself back more and more and more. And then suddenly when you've got some new teeth that don't come out, all these things that you used to have, the things you used to enjoy, the things you took for granted, now come back. And so people just not only look younger, but they feel sometimes decades younger because they're back being more active, traveling, being, just exercising and going out more instead of hiding behind their smile that they were embarrassed with before. And another reason people don't get this done is because they've been told they don't have enough bone. And in almost every case, that's simply not true. It's just a matter of knowing how to utilize the bone they have with various specialized implants and techniques to give them teeth again.
Do you ever work with patients that have been told elsewhere, not enough bone, and now they have upper and lower teeth that don't come out?
A lot of them. And then they maybe found their way to me because they have a friend who got this done.
Okay.
And the friend was also told something similar. So that might be why. Another reason that people don't get this done is because they count their teeth and they think it's too expensive. They think, well, maybe it's $3,000 or $5,000 for a single tooth, and they start counting them, and they do the math, and they think that's going to be $50,000 just for a full set of upper teeth, and it is significantly less than that. You don't need an implant for every tooth that's missing. You only need 4. So 4
for a whole arch of teeth.
4 for a full arch of teeth. If you've got enough bone for 6, we're going to put 6 in there because I think that's just a better hedge against, for longevity.
Correct me if I'm wrong. On the day of the procedure, they could walk in with no teeth and that day walk out with upper and lower teeth that don't come out.
It's amazing, isn't it? Yes, that's exactly what we do.
Okay.
So those types of patients, we have 2 types of categories. Okay. First patient we have is typically had broken, missing, or painful teeth. They've been going through a dental hamster wheel, like a treadmill of constantly fixing up teeth that break, decay, and it just gets more expensive every year. And they see the pattern where they're headed toward losing all their teeth, and they're afraid of a denture. They don't want a denture because they know their life is going to get worse in that denture.
So they go to you because they don't want a denture.
Yes, and maybe
Okay.
they've been to another dentist and they said, I can't do anything for you. You have to have a denture. There's nothing else that's going to work.
Okay.
And so perhaps because they've heard that we do implants, they give us a call, and they just want to see if there's any hope left for them. So that's one type of patient. The other type of patient is people who've been in dentures already, whether it's 4 months, 40 years. These are the types of people that we can help the most, actually.
So what do you mean by that? You can help them the most.
Well, when you have a denture, you can't eat or chew very well.
Okay.
And that has a lasting impact on your psyche. People tend to lose their confidence, not just with their food, but a lot of times in their social life. They don't always want to go out as much as they used to because they're
Okay.
afraid of their teeth coming out, or they can't order that juicy steak that all their friends are having at the time. And so when people suddenly have teeth that don't come out, everything about them can change in a short period of time.
Now, where you are, you're very well known for these radio ads because
That's correct.
they say you have a distinct voice.
That's true.
And they're funny ads. I
thank
heard
you.
one.
Yeah.
I heard a couple.
Yep. My voice just stands out. It's probably due to hearing loss I had when I was 2.5. So, it's just how I sound. And
Did
when
you
I'm
say
there,
that when you're talking, sometimes people recognize you from the
oh yeah,
radio ads?
Yep. I can just be at the gas station or something like that, ordering a snack or whatever, and it's just, you that guy from the ad? Yes, that's me, Dr. Bowman. So it happened pretty often, actually.
Very nice.
So.
Now, at the top of this show, we said no more dentures. Do you think that's the future of dentistry? Like whether it's 20 years or whatever, that dentures will be gone, they'll all be attached to like something like implants?
Well, Randy, there's not much reason that future can't be now. We have all the technology that nobody has to wear a denture anymore. It's become much more comfortable, much more affordable. And in our office, we can do it much more quickly than most ways to get it done.
Why?
Well, the typical way in the U.S. is somebody has to go to a surgeon to get the implant put in.
Okay.
Then they got to go to a general dentist to wear a temporary denture for 6 months. Then they got to go back to the surgeon 6 months later for another surgery. And then you got multiple appointments with the general dentist to get, their set of teeth designed, fitted, get the bite so that the teeth come together right.
Okay.
And then you still have to maintain these things. And the problem that most patients have is they don't know who to go to, how long it's going to take, or how much it's going to cost. And so that's why we do all that stuff right in my office.
Now, you print the teeth
We do
in
that
the next
too.
room.
Yeah, we do
Is
that
that right?
too.
Like
Yep.
you have an in-house lab kind of a thing?
We've got an in-house lab. We've got a digital workflow. So right after the procedure where the implants go in, we got technology. We have our designer custom designed teeth for that person so that they look the way it should, they fit the way it should. We've got some people who want their teeth to look completely different. Others don't want their teeth to look any different at all. They like the way they look, but they know that their teeth are not going to stay in their head for very long.
Okay.
So we get that done the same day.
So correct me if I'm wrong. This could be done as little as 2 visits. You meet them, determine whether they're a candidate, and then the next visit could be they get their new teeth.
That's as quick as it can go.
Okay.
We see them for a consultation, get to know you, want to find out what your needs are, see how you want your teeth to look when we're done. And then we'll design the teeth in between those appointments. And then, yes, you'll come in with bad teeth or bad gums or no teeth, and you're going to walk out with a brand new set of teeth that look natural, and nobody can tell that they aren't your original teeth.
Now, what if you have a denture for like 15 or 20 years? Isn't it true you don't have enough bone to do it?
That's not true.
No?
It's actually pretty common that we hear that from patients that come in. But now with the techniques that I've learned, the technology out there, you don't have to have a ton of bone anymore to have good, long, strong implants that will hold your teeth in.
How old can you, like what's the upper range of somebody getting
There's
this?
no limit. We've done implants for a guy who's 98.
So why would a 98-year-old want to do this?
Randy, when you're 98, you want to be able to eat and chew and keep on going.
Okay.
You made it 98 years already. We have one fellow who's that old. He fought in the Battle of the Bulge, helped us win, the war in World War II. And so, he had his teeth for a good long time. Over time, they'd worn away. He lose a tooth here, lose a tooth there. But he had the goal of living till beyond 105.
Was he wearing a denture when you met him?
He had a partial denture. And it came time where he was going to need a full one, and he didn't want that.
Okay.
So, he came in one day with those 6 remaining teeth that he had, and he walked out with a full set.
Upper or lower teeth?
Upper and lower teeth.
I mean, you were a little nervous, though, out of a 98-year-old, or no?
A little bit. He was a healthy guy. If you're healthy enough to walk into my office or just make it into the chair, great chances you can walk out with a new set of teeth that don't come out.
So when you hear like a 70-year-old saying, Doc, am I too old?
The
Not
answer
at
is,
all.
of course not. They're a spring chicken.
Okay.
Their life, they're probably early into retirement. The next phase of their life is just getting started. And when you're retired, you don't want to become a couch potato and just wasting away, which we, sadly, sometimes we see. But when you've got a set of teeth that you can work with, you have no restrictions, that you like the way they look, you're not afraid to travel. You're going to go try that juicy steak out in Italy or Portugal or whatever you're going to go.
They could eat whatever they want.
Pretty much, yeah.
Like with their front teeth, or they have to be careful with the front teeth? Like biting into an apple?
Not these patients. These patients who get their implants and teeth that are anchored in, the only one who can take them out is me. And so there's just no reason for that to happen. There's no restrictions on what they can have, what they can go out. And I can tell you, a lot changes in these people once they have their teeth that no longer come out. It's like having that third set of teeth that nature never gave you. So what you get back is maybe everything that this 75-year-old was able to do when they were 35, 40. They were active, they were going out, they were socializing more. And so it's more than just a smile that they're getting back.
How soon can they eat after you give them their new teeth?
An hour, right away, as soon as they get home. Have that apple.
Just like take it easy at first and then
you can eat whatever you want. That. But really, in the end of it, there are no restrictions as long as it's regular food that, if we can eat. If you can break a tooth with a natural tooth with this object, don't chew on it. But, within reason, there's nothing that you can't chew.
What's it like? I know you brought photos, but what's it like when they see themselves in the mirror for the first time?
Well, it tingles my spine. I get these chills every time I see it. I get so excited because they don't know what they're in for. What they see at first is a great smile. They start crying sometimes, but it's when we see them for follow-ups a week later, a month later, and you see a different personality of them emerge that we didn't know existed before.
Like you get them all wrong. You think it's maybe a stuffy person or serious person.
Yeah, I've got a great example here.
Let's take a look. Let's take a look.
So here's this guy. This is his version of a smile when he came in.
That's
for
him smiling.
We tried to tell some jokes. We tried to just, whatever I and the girls could do to get him a smile so we can see what he's starting with. But he's hiding something. He doesn't have teeth. He had some poorly fitting dentures that he never wore, didn't care about them. I don't remember if he came in because he wanted something or because his wife wanted him to come in. But if we just take a look at his picture, take a look at his eyes, Randy.
Yeah?
What do they tell you?
Well, he looks pretty serious.
They look pretty serious. We think maybe he was, had a perception of being kind of a sad guy, not somebody who wanted to laugh much or talk much. His answers and responses to us were very short and pointed and very non-engaging when we started. His option would have been a new upper and lower set of dentures, but no way, that's why he came to us. He doesn't want that. His wife doesn't want that for him. So we gave him a brand new set of upper teeth. And someday, I hope he's going to get his lowers because he seems like a very different kind of guy now.
Okay, let's take a look.
So.
Oh, that is a big difference.
Yeah, it's a huge difference. Does it even look like the same guy?
No, looks good.
Well, let's take a look at the eyes here. You see his eyes in the before picture.
He looks happy.
You see the eyes in the after. You see he's smiling with his eyes for the first time ever. That was an effortless smile compared to when we started. We couldn't get him to smile even if we tickled his belly if we tried that.
Now, you said you may have misread him, like he was just a serious guy.
Yeah, he didn't show much personality with us. He didn't seem too confident. So now when he comes in, we see him. He stands more upright. He smiles more. He's much more talkative with my staff. He's more talkative with me. We ask him how life is. He says it's great. I think the pictures are pretty self-explanatory on what a smile has done for him.
Now, you say people have regrets. All of these, that means they wish they would have done it earlier. Mm-hmm. Elaborate on that.
Well, they don't know what it can do for their life. Some people think, well, maybe it's just new teeth to help them chew and eat more. Others just want a better smile. But it goes a long way in their social life, in their personal life. I've had a patient who has said that she loves herself so much more, since she got her teeth. It's been so long since she's felt that way about herself. And it's not just her, it's not just him. This is for everybody who gets this done.
Do people do this for special occasions sometimes? Like
Sometimes
daughters
they do.
getting married, they want to smile in photos?
All the time. Special occasions will do it. Weddings, their child's getting married. They don't want a denture. They don't want their teeth to come out when they're having that speech for their son or their daughter. And the beauty of this process is we can get them in very shortly later. They walk in with their teeth that they have, and they walk out with brand new, great-looking teeth that can't come out. We have another guy who came in, and he said he got out of a toxic relationship since he got his new teeth. Now, he'd been thinking about doing it for a while, but he never had the confidence to step outside that because he wasn't sure how somebody new was going to feel about him.
Okay.
And he had, since getting his new teeth that anchor in, he's a lot more animated. He's flirting with, the lady in the office. He's obviously flirting with other people. He's got a new girlfriend. He's just a much more happy, relaxed kind of guy now.
Now, what if you have bad gums, like gum disease? Can you do this? Are your gums too bad to get this done?
Absolutely. Traditionally, in the old ways, they would say you've got to clean your teeth up. You've got to get your gum disease taken care of before you get your teeth out and your implants in. But that's not how we have to do it anymore in our office. And so that's our typical patient. They come in with a mouthful of infected gums, infected teeth, loose teeth pain, and we clean all that up. It's a very simple procedure, and we do it by painlessly and safely removing the teeth. We clean up the infected areas of the gums.
Do the gums get healthy again?
They get healthy again right away because you get rid of that source of the infection, which is the bad, unhealthy teeth that are sitting in there.
What about bad breath associated with gum disease?
Yeah,
Does that go, and how soon?
It goes away within 2 days or less.
Okay.
So there are lots of people with infected gums. They've got bad breath that never seems to go away no matter what they do. They're brushing and flossing their teeth far more often than we are, but they can't get rid of it because the gum is too deep, the infection in the gums is too deep up there.
Okay.
And so sometimes that's the most efficient way to get rid of the infection. Well, here's another patient.
All right.
She came in really out of hope. She had a denture. She hated it. She thought she was going to like it because
upper
it looked
denture
good.
she
It's
had?
an upper denture. She got lower infections in the gums. And she didn't want teeth to come out. She was tired of her upper denture, did not want to lower. So we gave her a new set of teeth on top in a day, and they don't come out. So have a look at her now. And would you say she's more attractive looking now?
Yes.
See, that's just not her. That's everybody, because her smile is more attractive than a frown.
Okay.
She has much more confidence than she ever had. But if you look at her smile, she's smiling better than she was in her first picture. But not fully yet, because she'd only received a few compliments at this point in her life since she got her new teeth. But give her 10, 12 more, and she can be smiling fully broadly.
So they have to learn to smile all over again, because you told me that on the phone. Is that what you mean?
They do.
Like they're so used to not smiling, like that's not a full smile yet. She's still kind of hiding it, but that'll go away. It becomes a big smile?
Yeah. So that's not a full smile yet. She's still kind of hiding it. She's forgotten how to smile because of years of trying to hide it, masking over her teeth. She tell me that she doesn't like to talk anymore before she got her teeth because she was concerned about her bad breath. It never went away. They didn't look good. They had stains in them.
What do they like more? The way it looks or what they could eat?
It can be either one. We've got sometimes a tough guy that comes in. He smiles all the time anyway. He likes himself. He just wants to eat a steak. He wants to eat the local corn on the cob that comes out every summer in the area. Some people come in and all they care about is the way it looks. They've been embarrassed by their smile for years. They just want a nicer looking set of teeth they can smile with. But then they go home and suddenly they have that salad for the first time in years that they can finally chew it. Their steak suddenly they enjoy more. So they become foodies again.
Okay.
When you have bad teeth, you're used to eating soft or unhealthy food that, they just get you through the day. Now you're making plans, you're going out, you're enjoying the fancier restaurants, you're going on cruises, you're trying the local food at these stops, and you're coming back and they're telling me about these things. I want to show you this guy right here.
All right.
So, he's got a few teeth left. He's a happy guy already. basically wanted to eat that steak again. So his main concern was he wanted to know if he can get his teeth in time for a corn on the cob season, which happens every summer.
Is that right? Okay.
Absolutely. And, that was just a short period of time away. And yes, he came back and he said the corn's better than he's ever had before.
So let's take a look at that after.
Sure.
So this is a guy that his option would have been a denture, and he has upper and lower teeth that don't come out.
Yes.
Okay, let's take a look.
And look at him. This was the next day. He came back. He wanted to tell us how much he loved his teeth. And I think he liked them so much, he forgot to actually change his shirt.
Is that right? Okay.
It is, yeah. And his wife pulled me aside behind the room. She says, I know he's needed this for a while, and I feel like you've been put in this area for a reason, and I think you just made a fine example of what that reason is for.
Very nice.
Yeah.
Now, we should mention at your office, because you just don't do dental implants. You'll save teeth when you can. You have a team of other dentists.
Yeah.
You have a pretty large team.
Yeah.
So, but you do everything right there. In fact, I don't want to put words in your mouth, so correct me, that what would typically take maybe 2 or 3 specialists, you guys do right there.
Yeah, we pretty much do.
Because people don't like going to the dentist, right?
Exactly.
Do you ever hear that? Like, no offense, doctor?
People want their one-stop shop dentistry, and that's what we do at Bowman Dental. We do most everything that comes in through the door. There may be a challenging root canal or something like that we might send out. But people like coming our way because we're not, implants can change lives, but we're not just going to pull any tooth that doesn't need to be pulled and give an implant because they want it. We're only going to do this for people who really, truly have that need or have no other great option because they don't want a denture or, they don't want to keep their teeth as they are.
Okay. Now we should mention, because a lot of people even email us, they want to know, they complain about the cost of implants, right? And, dental insurance doesn't really cover this, even the best dental insurance. Medicare, Medicaid doesn't cover this. But you say people are financing this.
Yeah. Dental insurance will help a little bit, but dental insurance is meant to be more of a preventive thing. They don't design it so that they can cover implants and new teeth en masse. So, 8 out of 10 of our patients are getting financing for this.
Okay.
They're not millionaires. They're not, white-collar retirees. These are everyday Joe, working class. And we work with a couple great lenders.
You have to have okay credit to
You gotta
get
have
this
okay
done.
credit. We have a few great lenders that have really been able to make this happen for our patients when just a few years past, we're not able to get them the same types of financing.
Now, we're short on time, but I know you have a stack of photos. So we'll try to get to as many of those as possible.
Of course. Well, let me show you Bruce. So he was referred by my friend, Dr. West. She saw what was going on in his mouth. He's got gum infections everywhere. He had loose teeth. She wouldn't even take an impression for him because they were both afraid that the teeth were going to come out in that impression. And so was I. He didn't want a denture. So she knew that I did implant and wanted to know what we could do for him. So
let's take a
what we
look.
did for him, we did an upper and a lower set in an exceptionally short period of time
Looks
for him.
good.
If you look at the first picture, he's forcing a smile. He's embarrassed to show us what he has, but he's okay with it. But when you look at this other picture, you can tell that the teeth kind of strongly resemble the shapes of what he had 20, 30 years ago when things were healthier, looked a little better. And so he's very happy to have some teeth that just look very natural and function very well.
He's too young to be wearing a denture.
Everybody's too young to be wearing a denture.
Okay.
Nobody should have to wear a denture anymore these days based on what we can do for them. So here's another person.
Same thing.
Same
Would've
thing.
Had a denture.
Similar thing. Loose teeth, gum disease, hated her smile, didn't have any confidence. She would talk like this because she was concerned about her bad breath. She was concerned about just the way her teeth looked. And this was her right after we gave her teeth back.
Nice.
And we follow up with her, and you can see in her testimonial video how much she feels like she loves herself now. It's more than just about eating the food she wants and not having bad breath or having unsightly teeth. This is something where she says it changed her life, and I didn't do that. She changed her life. She gets all the credit because she made a decision to give us a call,
Very nice.
to move forward with it, and to say that she doesn't have to suffer with the poor teeth that she had and will have to get a denture. And here's another interesting case. Take a look at her teeth. If you look at them, you can see there's a little thing connecting in between them. Those are composite bonding. She had very loose teeth from very aggressive orthodontics that she had when she was younger. So over time, her teeth just got looser and looser because there was hardly any bone left for her. And even though her back teeth on top were in pretty good shape, she was concerned about getting around with, a denture, and she didn't want that. And she also didn't want to look different. So the main thing with her priority and her concern was for nobody to notice that anything had happened, because her teeth might have looked okay, but because they were not going to be held in very much, she wanted to go back to work 2 days later. And
those look real.
Yeah, they do. And they are close copy to the shapes and positions of her teeth. And the only people that know that she had anything done, are her family. They just know that she had something done, but they don't know that all her teeth are sitting on implants. And this was just 2 days later.
Now, it seems very painful, but you say they're numbed up, they get sedation.
Yep.
They have like almost no memory of the procedure?
100%. They're numbed up. It's very minimal discomfort. In fact, prescription pain medication, narcotics is something that we virtually never prescribe for these people.
Like, what do they take the next day?
2 Advil, 2 Tylenol. They do that for a day or two, and that's really all most of these people need.
Is it one of these things where they worried more about it, and they're saying this was a lot easier than I thought it was going to be?
Absolutely. Nearly 100% of them. So,
very nice.
And that's a big reason why a lot of people held off so long to get this done, is because they were worried about pain. And then maybe they heard about it from a friend, or maybe they just get fed up enough. But we offer sedation, which kind of gives them a euphoric experience. A very little memory of the procedure.
Okay.
And it will make a few, maybe 4 hours feel like an hour and a half. So they go through a bit of a time warp with this.
Well, that's
They're
nice. Comfortable.
We numb them, so they feel very little during the procedure, and they have very little recollection of it. But they wake up out of this sedation, and they've got their teeth in there, and they go home, and they can look in the mirror. They go have dinner.
Okay.
It's a very straightforward process for them.
Now, we're out of time. But you have a 3-step process. Again, correct me if I'm wrong. Day 1, you meet them to see if they're a candidate.
Yep.
Step 2, smile design on a computer. Do they ever get to see, by the way, what their teeth are going to look like ahead of time?
Exactly.
And then the 3rd step is you get your new teeth.
Yeah, basically explained it all.
That's it.
That's it. Just come in for a consult, meet us. We find out what you want. We show you what your teeth are going to look like. You approve them. And then you come in with whatever teeth and gum disease, bad breath you might have. And you walk out with a healthier, great-looking set of teeth that don't come out.
We are completely out of time. But if somebody wants to make an appointment, do you prefer they go to the website or just call your office?
They can go to the website or call us. Either way, they're going to get through to us. I encourage the website so they can get to take a look at our examples, read about some of the stories that we have out there of people we've done for, and just find out if it's the right thing for you.
I want to thank you for coming on the show. Good stuff. Did they get to meet you on the consultation?
Yes.
Okay. Dr. Bowman, I want to thank you for coming on the show. Good stuff.
Thank you, Andy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.